Again, welcome everyone. We want to welcome you to the Regent Revenue Cycles interactive webinar on gaining more control and efficiency through outsourcing ASC RCM. Just a few housekeeping items before we get started, as we want to encourage questions and participation by the audience. We will leave everyone and all participants unmuted for the session. Please be aware of that and feel free to mute yourself while not speaking so we can avoid any type of background music or noise. With that said, please feel free to jump in at any point to ask questions to our experts. You can also submit questions via the GoToWebinar participation panel on your screen. Now I'd like to introduce Ed Tashan, Director of Business Development at Regent RCM, who will do some additional brief introductions, and then we'll get started with the presentation.
Thank you very much, Jason, and good afternoon to everyone. Again, I'm Ed Tashan, Director of Business Development here at Regent Revenue Cycle Management. We are broadcasting live from our headquarters in the western suburbs of Chicago. Definitely want to welcome everyone and thank you for carving out time with us. We know that the fourth quarter is an especially demanding time for centers. Sensitive to everyone's time, I would like to introduce today's webinar host, Mike Orsino. Mike leads Regent's revenue team with 17 years of experience and really brings a true focus on improving financial outcomes for ASC clients. Also with us today, we have Regent's 3 revenue cycle supervisors, Leslie Favela, Sandy Lagunas, and Bianca Batista, to also offer their experience to any questions that may arise. With the nature of today's topic, we very much welcome your questions throughout the presentation and would be happy also to schedule time one-on-one as well after the event. Mike, at this point, I will turn it over to you.
Thank you, Ed, and good afternoon again from sunny Chicago. I say that tongue-in-cheek because we're very cloudy and overcast and kind of an otherwise gloomy day. As Ed and Jason alluded to, we would like this to be interactive, kind of a in that light, I kept the webinar fairly short. It's not going to be the full amount of time with anticipation of taking questions and comments during the webinar. So without further ado, let's get started. Let's go through the agenda first. We've already taken you through the introduction and ground rules. We're going to talk about the evolving state of the ASC RCM industry. And then we'll talk a little bit about what's driving the ASC competitive advantage for your ASC. And the 4 pieces we're going to hit upon is the expertise, process automation, smart staffing, and real-time measurement and reporting. And finally, we're going to tackle some common myths of outsourcing revenue cycle. So let's first talk about the evolving state of RCM. What we're seeing is an evolving demand for RCM outsourcing. One, what provides facilities an opportunity to focus on core priorities? 3 different things. ASCs currently need to focus on patient experience, and this is really the clinical piece, quality, and compliance. It also allows, RCM companies will achieve consistent, predictable revenue. They'll ensure accuracy across the revenue cycle and realize optimal reimbursement. In addition, there's an allocated, dedicated resources for timely pursuit. What do we mean by this? Really, what we've seen when we've visited various ASCs throughout the country is, personnel that are there to do the billing and collections for the center are often not 100% dedicated to RCM. What we've seen is they may have to provide, clinical assistance for patients. Sometimes we've seen them doing IT, being the IT resource for the facility. It's not uncommon for us to go in and have the biller collector be pulled aside to clear the paper jams, or someone's computer is freezing, or doing front desk, medical records, these types of activities. And finally, we want to leverage technology for analytics and transparency. What was once a nice to have as far as technology is concerned, what we're seeing now is a must have. And technology, quite frankly, is expensive. So we've seen an evolving demand for in a holistic approach. So sustainable, predictable performance. Everyone wants it, but how do we get here? We see 6 traits and attributes as must-haves: expertise, control, transparency, technology, efficiency, and process. So let's look at the first competitive advantage of outsourcing. That's the expertise. When looking for an outsourcing company, you want to look for one that has a high level of revenue cycle experience. And bilingual capabilities are a bonus. Here at Regent, we're always looking for a seasoned RCM professionals. Our team here has an average tenure in revenue cycle of over 10 years. It's over 13 years, actually. But the range from is 22 years on the high end. We actually even have a couple who are under 5 years. And even though we're always looking for the seasoned RCM professionals, there are some diamonds in the rough that we will take on and we experience. And actually, these revenue cycle professionals are very well performers. You also want to look for 100% U.S.-based operations with hands-on leadership. A lot of the companies out there nowadays, purport to have some of their or some U.S.-based operations, but some of it's devoted offshores. Here at Regent, we have 100% of us are here in Chicago and under one roof. There are several companies here who are maybe U.S.-based, but they have their operations in all different parts of the country, and that tends to get hard to manage. You also want to look for clear competencies in managing denials as well as payer contracts. You want to look for a partner who knows how to appeal claims when you're not paid the way you should be, and who has a very deep understanding of payer contracts to make sure you're going to get paid what you're supposed to be paid. Also, you want to look for a company that has recurrent audit cycles, both internal and external. Here at Regent, we have all the supervisors that Ed had mentioned previously. They audit their team of revenue cycle professionals quarterly for reimbursement. And then we do biannual business office audits by other management professionals on the same team. So, we're consistently and constantly auditing our staff for reimbursement. Aside from that, we also head up biannual coding audits. So we're doing both business office audits and coding audits. Another trait is to find someone to assist with the selection and implementation of technologies that address the individual needs and objectives of the center, both current state and the desired future state. We'll get into that a little later. You also want one who will navigate the complexities of ongoing regulatory and compliance changes. And this speaks to the audits that we perform continually throughout the year. We'll look for, and we have people who are dedicated to the regulatory and compliance changes. And oftentimes what we'll find, if you're insourcing, you may not have that deep of a team to be able to continually address the regulatory and compliance changes. One who has a keen understanding that the billing process directly impacts patient satisfaction. I talked about this in October at the Becker's conference. You could do a whole presentation on how we can impact patient satisfaction, but think about it this way. You can have a patient that comes in and has a wonderful clinical experience, the operation goes smoothly, and they are very satisfied with all the clinical and operational staff of the facility. But if they get a bill in the mail that's incorrect, or they encounter rude business office staff, that experience may change from a very positive experience to a very negative experience just by the billing component. And finally, one who prioritizes and aggressively improves core financial competency metrics, which I'll cover on the next slide. Any questions or comments about the expertise? Okay. There are several key performance indicators or metrics that we recommend that a facility tracks, that we track continually. And that's days outstanding, or sometimes referred to days in AR, claim lag and charge lag, percent of AR greater than 90 days, net collection rate, denial percentage and clean claim percentage, and, excuse me, a metric that's not readily available, but one that we've developed internally. So this is a region-specific metric, and business office staff per 1,000 cases. Days outstanding, or days in AR, in its most basic form, it's essentially the time it takes for a claim to get paid. And the calculation is your total amount of AR, and depending on how you want to calculate it, here at Regent, and the most common method is a rolling 90 days, but you can do it on a 30-day cycle, or you can do it on a 12-month cycle. But it's your total AR divided by the total charges from the last 3 months over 90, and if you're doing it 6 months, it would be 6 months over 100. What is it? 6 times 30, 180. So that's the calculation. And the standard that we strive for is less than 30 days. Obviously, this is going to differ if you have a out-of-network facility. We expect this to be higher. If you have a facility that is, mostly Medicare and they're doing pain and eyes, essentially, this standard, we expect it to be much lower. So we have a center that is one that I just described, and that center is continually around 20 or less. And the uses of this metric is it determines the health of your AR. And if you've seen wild swings from month to month, this may highlight a billing or collection problem. Claim lag and charge lag, this is the time it takes to get a claim entered and sent. The charge lag is the data service to charge entry, and the claim lag is data service to claim submission. And the calculation is the number of days from data service to charge entry divided by submission. The standard is for Regent is less than 3 days, but we all know that can be, we can have wild swings in this under no control of our own if we have a physician or several physicians who don't dictate in time. So this one, as much as we strive to get this less than 3 days, there may be times where it's over 3 days, but there's nothing we can do about it, unfortunately. It's really just our communication back to the client to try to get those doctors to dictate in a timely manner. And the uses of this determines how quickly charges are being sent. If you see a high claim or charge lag, this is a negative impact on days outstanding. So imagine your days in AR are really 30, but if it's taking you 5 days or 6 days to get the claim out the door, that's 6 days added unnecessarily to your days in AR. Your percent of AR greater than 90 days. And this is just the amount of dollars as it relates to total AR greater than 90 days. It's total AR greater than 90 days divided by your total AR. Our standard is less than 15%, and a high percentage of AR greater than 90 days may emphasize an issue with patient collections or insurance denials. Net collection rate, this is the percent of eligible dollars the facility actually collected. So how much out of a contractual amount that we were supposed to get paid did we get paid? And it's the calculation is total payments divided by the total charge minus contractuals minus bad debts plus refunds. Our standard is greater than 97%. And this essentially determines how well the business office staff are collecting on your contracted amounts. Denial and percent of claims that are rejected by the payer, and the percent of claims that are sent without edits. Calculation is your total claims divided by denied or your clean claims. Our Regent standards, we want to send out 98% of our claims clean and have a less than 5% denial rate. And the uses is a high denial rate because it highlighted issues with certain payers. A low clean claim percentage may pinpoint some issues with either your biller or front office. And finally, this is the metric I spoke to that we developed. In 2010, when I came here to Regent, a question I commonly got asked is, how do we staff our business office? What is the correct number of billing office staff that we should have? I didn't find any available statistics on this. So having 14 ASCs at the time, I just decided to start tracking it and see what the results look like. So in the first year we did it, in 2010, this is the average, the FTEs per 1,000 cases. So the region average was 1.85 out of all our facilities. And the trend that I saw initially was that the number of cases is plotted on the left, and then the business office FTEs on the right axis. What we see is the busier centers toward the left tended to be more efficient than the less busy centers. And the reason we could probably take away from this is that our less busy centers, you see a few of them less than 1,000, all 4 of them less than 2,000. You may have a receptionist, for example, and that receptionist may not be fully utilized in a not busy center, but we couldn't split that person in half. So, oftentimes we were seeing an FTE there that maybe wasn't fully utilized, but there wasn't much to do about him. And as opposed to a busier center, that person would be fully utilized. As we progressed, I did this study again in 2013, and as you can see, this trend kind of continued with the busier cases being more efficient, but with the implementation of some policies and procedures and some technology, we gained efficiencies. And you can see our average dropped down 1.76. And going through to the next year, you can see in 2014, our average dropped to 1.52. Now, in the 4 years that we did this study, we saw an efficiency gain of about 1/3 of an FTE, which doesn't sound like much, but you got to remember that this is 1/3 of an FTE per 1,000 cases. So in a center that does 5,000 cases per year, we're looking at a reduction of 1.5 FTEs, which could be a savings of about $100,000 for a center. And really, this was without doing much except for efficiency gains that I'll talk about later, and the implementation of some technology. So we'll talk about the key performance indicators. And what I want to say is we've gone through all these metrics, but metrics don't always tell the entire story. Consider this. In the list of the following hypothetical ASCs below, and I've taken this question right from an assessment that we give any candidate who wants to be a business office manager at any of our facilities. So in the list of hypothetical ASCs below, assuming charge masters are the same, which one of these is in the best financial position and why? One that has a days in AR of 35, net collection rate of 97, percent of AR over 90 of 11, and gross collection rate of 69, or a center who has days in AR of 23, net collection rate of 99, percent of AR greater than 90 of 6%, and gross collection rate of 63, or the last center who's kind of lagging with days in AR of 40, net collection rate of 92, AR over 90 of 16, and gross collection rate of 74. Does any participant on the call want to venture a guess and give a reason why? Anyone brave enough? Awesome. I'm sorry. Did you guys, was I just unmuted and did you not catch anything I just said? No, we're good?
We're good.
Okay. So at the end of the day, what's happened in our industry is people become so focused on metrics that they forget about the key performance indicator, and that's really cash. So at the end of the day, metrics are great and they tell a certain story, but at the end of the day, we want to make sure that the cash is coming in the door and we're collecting as much as we can. Next competitive advantage I want to talk about is process automation. Automated revenue cycle is as much about as efficiency as it is analytics. Customizing an integrated solution to the individual needs of each ASC becomes most important. And the three core areas of technology form the foundation of ASC billing and collections. One, it's the management information system, that MIS platform we speak about. And this truly is the lifeblood of the ASC. And the MIS has evolved, and it's important that the first word here is very important. You want an ASC-specific management information system. And the ASC MIS has evolved in recent years, and it doesn't just do billing and scheduling, but does inventory management now, interfaces with clearinghouses, and performs a whole variety of functions. But it is the lifeblood of the ASC. I think right behind the MIS in importance as far as technology is the clearinghouse. The clearinghouse obviously is used to sending and receiving claims, but there have been many advances in clearinghouse as well. For example, I spoke about the number of FTEs per 1,000 cases, how we reduced it. One of the ways we did that is through the use of our clearinghouse and management information system in conjunction through online eligibility. Gone are the days where staff are spending an enormous amount of time talking with the insurance companies to figure out what the patient's eligibility is. Now we can do this with a single click and be able to pull all the eligibility information into the management information system and view it. And that includes, deductible remaining, co-insurance, whether the patient's eligible, and that kind of information is used then to estimate out-of-pocket and inform the patient. Last technology that we wanted to talk about is reporting, analytic, and dashboard capabilities, and I'm going to cover that in a little bit, but equally as important. So really, it's the staff expertise, which is essential to a smooth implementation, as well as leveraging the full functionality for your return on investment. Here at Regent, we performed both small and large-scale implementations, and we have a specific team, we call it a SWAT team, to be able to perform this function. And this team, when we have an implementation, and what should be expected of any outsourcing partners, to spend some time on site at that client. So when you go live, they work in conjunction with them to make sure that there's no interruption in cash flow. So they're sitting right alongside that front office staff, to make sure that they understand the policy and procedures of that particular center. And in addition, very strong relationships are formed with key revenue cycle vendors who have gone through this implementation as well. So if, for example, a facility needs, let's say they're looking for a MIS or a clearinghouse, we can implement that at the same time. We've done it with many centers, so this should automate that process. The next competitive advantage I want to talk about is smart staffing. Experience is critical to evolving complexity and accurate decision making. So you got to ask yourself, how can I find the ASC billing and collections expertise? And will the person that I hire be an immediate contributor, or do I need this time with extended training? And really, what we've seen in one of the driving forces behind outsourcing is, is there where I'm located, do we have a deep talent pool, or is the talent pool fairly shallow? We had a client that was in the middle of New Mexico, and for obvious reasons, they had a very shallow talent pool, and they had a very hard time keeping and retaining and finding experienced RCM personnel. Contrast that with, we had another center in California, Santa Barbara, which is a very wealthy suburb of LA, and you wouldn't think they would have a problem finding talent, but in fact they had a very hard time finding billers and collectors because no one could afford to live there. So they actually had a shallow talent pool as well. The only people they could find had to drive 50 minutes to an hour, or they lived with their parents, which was a temporary solution for them. So the goal here is to get passionate employees that act as fully engaged partners and are in fact extensions of the centers themselves. A good outsourcing partner will have dedicated specialists who will create that right culture. And one of the things that we do here is we create a one-to-one relationship. So we have, instead of having a team of billers and a team of payment posters and a team of collectors, we have one person that partners with the center who provides all the revenue cycle functions, the billing, the payment posting, the insurance, and the patient follow-up. And that creates high degree of satisfaction between not only the center, because when the center BOM or the center staff have to call us and for a question, or they're always speaking to the same person. We create that same high level of satisfaction with the patient, because when the patients call in and they have questions about their bill, they're always going to be speaking to the same person, and in fact that person is intimately familiar with their account. So that creates a high level of satisfaction. So consider an organization's reputation in the marketplace is a strong indicator of a candidate's pipeline. And we have an example here at Regent where we hired one person through the external marketplace, and she was a very good, bright, and proved to be a very good employee for us. In turn, she has recommended us to two of our other former employees who have each come in and applied for jobs here and who have been subsequently hired. So that kind of reputation in the marketplace, if you create a strong culture and have a good reputation, that breeds the experienced professionals. We leverage a rigorous hiring process, including the skills assessment. So I mentioned that assessment that we give incoming business office managers. We also develop skills assessments for incoming revenue cycle specialists. Anyone who wants to work here has to go through a skills assessment. And we also do a cultural assessment through a rigorous hiring process. So we have values called the RISE values, and they stand for respectful caring, integrity, stewardship, and efficiency. And all our hiring process is geared around these values. And finally, the succession and contingency planning. This equals the continuity and predictability. So in an ASC that has insourced revenue cycle management, you have to plan for your employees who go on extended leave, let's say pregnancy, and they have a maternity leave of 6 months, or you lose employees to attrition. What happens when you have that one employee doing that, those functions? What happens during that time when someone's off or you lose the employee? These are some of the gaps that outsourced revenue cycle can fill. Any questions on staffing? Okay. Move on to real-time measurement and reporting. So standard ASC platform capabilities tend to have canned reports, but oftentimes these canned reports aren't enough. Most reputable outsourced RCM vendors will be MIS agnostic, and meaning can work with any management information system. So if a center already has a management information system in place, that vendor should be able to come in and work on that system. There are some out there who have their own system, and that may work, but they may charge more. So just something to be aware of. We've taken it a step further and gotten some custom software capabilities, and a lot of outsourcing partners can do this. They offer next generation reporting and analytics, and it's really that individualized versus generalized data. We're able to do customized reporting. So we have this robust reporting tool that sits on top of any MIS and gives us customized reporting with slice and dice capabilities. So consider Dr. Smith at your surgery center who wants to see from his third quarter all Blue Cross cases done on a knee arthroscopy with a certain diagnosis, Blue Cross patients only that were reimbursed 80% of contractual. We can pull a report like that in this kind of software capabilities that we have. Then you establish your key performance indicators and then benchmark them against the industry performance, what we talked about before. You also should have the ability to have a real-time dashboard, or sometimes called a management console, which is graphical and fully customizable. I'll show you an example of this in the slide to come. And essentially, we're leveraging expert analysis to drive decisions. We want to help facilities through this reporting. We want to help the facilities arrive at your key financial institutions. Key financial decisions. And this creates actionable insight, which drives trends, issues, and continuous improvement. So in the previous slide, I'd mentioned a financial dashboard, and this is an example from one of our centers. And you could see some of the key performance indicators are in a kind of look like a speedometer in a car. Some of them are line, but what they all have in common, and what's great about this, is that the facilities the parameters are established by the facility. So if you look here at the days in AR, you can see that this particular facility established their green, yellow, and red, and their green was 0 to 60, 60 to 90 was yellow, and 90 to 180 was red. Now, obviously, we didn't establish these standards because typically we want to see green would probably be 0 to 30, 30 to 60, or maybe 30 to 45 yellow, and anything over 45 would be red. But again, this could vary based on what kind of center you have. So at the beginning of my presentation, I talked about if you were an out-of-network facility, then maybe this would be skewed more toward something that's displayed here. If you were a facility that had a high Medicare population or maybe high eye and pain cases, it may be skewed the other way. So these are all these parameters can be established facility by facility. The one interesting part of this is the cash collected metric that's here, and it's a percentage of how much the goal is. So the goal is not going to be a static amount. The way we've developed it, and we can change this based on the facility, but for most of our facilities, what we'll do is we'll say, okay, the cash collection goal is going to be the average of the last 3 months revenue minus 2% for bad debt. So that's automatically calculated, and that is measured against this. So it changes month to month, and it's a true representation of the goal of the month of collections. We're not just going to say, okay, the average for last year was 400,000. That's what it's going to be every month. This actually is continuous and changes. The other part of the dashboard, we couldn't fit it all on one page, gives more financial key performance indicators on the left side. I'm not going to go through them all, but you can see you can do supply costs per case, days to bill, days to paid in full, bad debt write-off percentage, net revenue per case, supply cost as a percentage of net revenue. And again, these metrics, we can set the parameters green, red, and yellow based on how the facility wants to put it. And we can also measure clinical key performance indicators. And you can see, again, I'm not going to go through them all, but patient fall percentage, equipment delay percentage, room delay percentage, excessive bleeding percentage. And again, these parameters can be set by the facility. and these pull directly from the management information system. So as long as your management information system has this kind of data, and even if it can't do the calculations, the dashboard will do the calculations for it. All it needs to do is be able to pull the data. So with that, I'm going to move into some common myths that we heard about ambulatory surgery center outsourcing. The first myth we hear is transitioning from an internal billing and collections team to an outsourced RCM team is challenging. And we agree it can be, but only with the wrong partner. So if you come to this and you're thinking about this, you want to select an experienced partner with an orchestrated transition plan and process in place. You don't want to be a beta testing site for RCM vendor. You want a partner that has been there, done that, has experience with both large and small clients, partners with technology firms that can handle more than one transition. So as I mentioned before, if you're interested in not only a new billing partner, but you want to, we've had one of our vendors one of our recent clients wanted not only new billing collections, but they wanted a new inventory system, a new coding system, and what else did they want? New coding, and a new MIS. And we did all of that at the same time. So, we were able to orchestrate that because we're used to working with these particular companies. And you want to make sure the partner has a vigilant focus on the three core elements of a smooth, efficient transition process. And that's the understanding of an alignment to the center's policy and procedures. And again, that really speaks to that SWAT team and that team being on site to make sure that the RCM company aligns with the center's policy and procedures. The RCM company should not be dictating the center's policies. The RCM company needs to abide by the policy and procedures set forth by the facility. Number two, IT system, flexibility, access, and compliance. You want to make sure you're complying to HIPAA laws, high-tech laws. When partnering with a facility, we ensure that all of our emails are encrypted with any kind of PHI attached. And if we use any kind of system where we're exchanging documents not by email, say like a Dropbox for pictures, but this is for documents, we'll make sure it's HIPAA compliant and high-tech compliant as well. And finally, one-to-one positioning. Several companies like Regent offer managed care contracting as a separate service, and that's critical. Second, here that a facility wants help with is number one is billing and collections. Number two, right behind it, is almost always contracting. So not only understand that the contract language, but really the positioning of how you're in the marketplace. And really, when you get a contract offer from Blue Cross, how do you know that's a good offer? Well, a good RCM partner will have worked in all 50 states and know what a good offer looks like from a particular payer and what a bad offer looks like. Myth number two, and we probably hear this most often, and this outsourcing RCM will be more expensive than handling it internally. And again, only with the wrong partner. With today's technological efficiencies, we've designed the RCM outsourcing actually to be more cost effective. We're one of the lowest in the industry, in fact. So as I said, we drive the significant cost savings with industry partners. So when you partner with a team like Regent, you'll realize volume discounts. So we take the 28 centers that we have, that we do billing collections for and that we manage and own. We have deep discounts with clearinghouses, with management information systems, collection companies, credit card processors, coding companies, and transcription companies. So not only will you realize savings with the billing and collections piece, but with the vendors as well. So even if you have a vendor in place, let's say you have HST or Zermed or Surgical Notes, for example, if you have them in place, by partnering with Regent, you may experience an even deeper discount than you may already have. And finally, the core elements driving that cost effectiveness. You'll see if you outsource, you'll see a reduction in salary and benefits, reduction in recurring training, a reduction in office space. So if you're a de novo center, instead of building out space for a business office, you may dedicate that to the clinical areas. Reduction in succession planning and recruitment costs, we talked about previously. Avoiding time and revenue lag associated with your transitions. And finally, the increased net collections. For example, we recently came into a client about 6 months ago where they were plateauing with their collection efforts, and they outsourced to Regent. In 6 months, we were able to, in the month of October, we doubled their average monthly collections. We recognize this as kind of a bump, and we rebuild a lot of things, so we don't expect that to continue. However, we do expect that we're going to be increasing their net collections by about 20% month to month. So 20% may not seem like a lot, but take if you're a $500,000 center, $500,000 in collections a month, that represents $1.2 million of increase in collections a year. So with that, I'm going to show you our ROI calculator, just to illustrate the point. So if you currently have one person doing in-house collections, and you're at $2 million in annual revenue, here's how the numbers shake out. And these are nationwide averages. So reduction in staff salary based on national average is about $40,000 for your biller collector. Reduction in Social Security, Medicare, and unemployment contributions would be about $8,800. Reduction in employee health care costs about $12,000. Reduction in your overhead that you spend, IT costs and training, $2,000. Succession planning costs, recruiting, time, and revenue lag is about $8,000. So really, the in-house billing-related cost reduction by eliminating that one staff person is about $70,800. Total cost of outsourced billing. So if you did outsource it to a revenue cycle company, based on national averages, it's about $70,000. So the annual savings by outsourcing is really only $800. But then you have to take into account the average annual collections improvement. And just on a conservative estimate that we can increase your collections, or an outsourced company can increase your collections by 3.5%, that's another $70,000 a year. So for this particular center, the total annual financial improvement was $70,800, and that's based on a 3.5% increase. That's saying nothing to the center previously stated that we are able to improve by 20%. Any questions on the ROI calculator? Okay. Finally, the last myth that we hear is, we've heard it quite often, is, when I outsource with my RCM, it diminishes my control. I'm a control freak. I like to have it, and when it's out there in another state somewhere, or maybe not within this building, I don't have any control anymore. And often it's a black box. And again, that's only with the wrong partner. We've actually put the technology we've used is actually designed to increase the center's control. The core elements supporting the enhanced control, I spoke about it before: a dedicated full-time billing and collection specialist, which eliminates the shared duties and diminished results, the deep experience and drives. And finally, utilizing best-in-class technologies. Having a robust management information system, utilizing workflow and process optimization, reporting and analytics, and real-time dashboards capabilities. We like to say we increase confidence through increased control. That's the end of the webinar. I'll open it up at this time for any questions or comments.
We're going to go ahead and unmute everyone's phone if anyone has any specific questions that they want to ask at this point. Any specific questions at this point? If not, we appreciate everyone's time today. We're ending a few minutes early. You can reach out to Mike or Ed or any of the team members with any specific questions. We will also follow up within 24 to 48 hours with the presentation slides for you to review and have access to. Appreciate everyone attending today, and have a great rest of the day.
Thank you.